Sjogrens. So we often talk about Sjogrens, and then we talk about Sicca, and then we say that Sjogrens isn't necessarily Sicca, and Sicca isn't necessarily Sjogrens. And so how do we tell the difference? What difference does it actually make in a practical terms? So we've got a patient who has PBC, definitely has dry eyes and dry mouth, and I'm not aware if there's anything, because there's also vaginal dryness that not many people kind of talk about publicly. There's some brain fog, joint, and bone pain. So they were tested for Sjogrens and tested negative.
Yeah.
Does that mean that they don't have the dryness? Does that mean they shouldn't be treated? How do we deal with this on a practical level, and what does it all mean? I'm playing that.
I've had some I've had some people contact me recently about developing a blood test for itch to tell if people are itching. Okay, what I said to them is, why not just ask people if they're itching? You laugh, right? Okay. Yeah. So, and they were not British, and I said to them, does a tree that falls over in a wood without anybody there still make a noise? And the answer is, of course it does. So do we need a blood test to tell if people have got PBC itch? No. Ask them if they're itching would be my. What you're going to do is somebody who's scratching, whose blood test is negative, you're going to tell them they haven't got it? You laugh. You have to laugh, don't you?
I shouldn't be laughing, but she was. Yeah.
Yeah. Okay. So somebody who's got dry eyes and dry mouth has dry eyes and dry mouth. Okay, because that's the equivalent of the blood test for itch. So, in a sense, if your eyes are dry and your mouth is dry, you have dry eyes and a dry mouth, right? I'll try and cut through the confusion here, because partly of this is about terminology, right? So there is a syndrome called Sjogren's syndrome, which is an autoimmune condition affecting the salivary glands and the lacrimal glands, the tear glands, okay? And it's associated by a specific immune process which has its own characteristic antibodies. So we have AMA in PBC, and they have their anti-Rho and anti-LAR and specific antibodies, right? And they also get joint discomfort with it. So Sjogren's syndrome is a well-recognized version of rheumatoid arthritis, actually. And I've got a colleague, who's the equivalent in Sjogren's of me in PBC, who sees people with this Sjogren's syndrome where they have dry eyes, dry mouth, they have poor tear production, they have joint disease, and they have these characteristic antibodies. Okay, that's Sjogren's syndrome. And that is treated nowadays by biological treatments, novel immunotherapies, it's steroids and things like that for that condition. Now, PBC patients, in fact, Sjogren's syndrome, the combination of all of those things with those antibodies, is actually very rare indeed. So we see it occasionally, like we see, multiple sclerosis, as we talked about, occasionally. Sjogren's itself is rare. But what we see very commonly in PBC is a version of that. It's a milder version of that, with milder joint problems, with often milder eye and mouth problems. And I know a lot of people with PBC have irritation with that, but people with full-blown Sjogren's have real problems with that. So there's a milder version, and they almost never have the autoantibodies, okay? So we see, think of it as Sjogren's light, okay? Now, what that means in practice is you have the process. It's part of, the associated things. And it's a little bit like lupus. We'll often talk about lupus in these calls. So lupus is another of these autoimmune conditions. People worry about it with PBC. And in PBC, we see lupus light, okay? So we see some of the problems of lupus, maybe some skin rash, maybe joint problems, but we don't see the really bad lupus problems like kidney problems or brain issues, right? So we see a version of it, but it's a mild, still irritating, still symptomatic, but it's not a bad version of it. Now that is Sicca. What I've described it as Sicca syndrome, okay? So if you think of Sicca syndrome as a big circle and Sjogren's is a smaller circle within it. So Sjogren's is a Sicca syndrome. Sicca just means dry gland. But most people with PBC technically have Sicca syndrome, but not Sjogren's, right? Now, what that means in practice is that you don't need the hardcore therapies that people need for Sjogren's, like biological drugs. But what you do need is symptomatic treatment for the eyes and for the mouth, okay? So it's daft to say you haven't got a dry mouth because the test is negative. That's most people with PBC. And you've got the problem, but you haven't got full-blown Sjogren's, so therefore it only needs symptomatic management rather than anything else. Now, occasionally my colleagues in the Sjogren's clinic have given the more aggressive therapy to people who've got really bad PBC type Sicca, but it tends not to be that common. Now, doctors are very bad at using the terminology correctly, including myself. So I would tend to talk to people in the clinic about Sjogren's because they've heard of it rather than Sicca. So I am guilty of that. But technically, most people with PBC don't have Sjogren's. They have Sicca, which is Sjogren's light. Just
okay,
to add, sorry?
Yeah, okay, I was going to come in, yeah.
Just to add a complication to it, okay?
Please.
We did some work a few years ago about all of this, about low tear production, okay? And we actually looked at people with dry eyes and we measured their tear production. And about half of people with dry eyes had poor tear production, and about half of people with dry eyes had normal tear production. You think, well, that seems very odd. But the people with normal tear production all had bad itch. So sometimes the sensation of dry eyes can in fact be itch of the eye, okay, corneal itch. So just watch out for that trap. The sensation is the same, but it's actually the itch rather than that. And actually vaginal dryness also sometimes can be that, okay? So just watch out for that. Itch isn't always itch. It can sometimes be these, in the same way as it can feel like creepy crawlies rather than itch, or pain rather than itch. Sometimes dryness of the eyes is itself just an itch phenomenon. So if you're not getting anywhere with artificial tears, just have half a thought about itch controlling therapies.
All right, perfect. Thank you. So I'm going to ask a question born of my own ignorance.
That could cover many areas, actually.
No, and it probably will. So is Sicca its own entity, or is it a PBC subset of symptoms, if that makes sense?
Oh gosh, that's actually a very good question, and it's semantics, really.
Okay.
I think so. You could have PBC without it, obviously. Okay. You can't really have it without PBC. Almost all those people have Sjogren's and have the antibodies. So I think you're probably right. We should think of it as a subset of PBC symptoms, actually.
Okay. All right. Okay. Perfect. So
probably.
I think
certainly, I think it's useful for us to do that, because I think we should be asking. I ask everybody. And there'll be people who see me in the clinic who will then say, no, he didn't ask me. And they're probably right. But we tend to ask people about fatigue, brain fog, itch, dry eyes, dry mouth. So I would actually include it in the roll call of PBC symptoms. Yeah. Right. And remember that just on the itch thing, remember anything that stops you sleeping makes other symptoms worse. So fatigue and brain fog are always made worse if you're not sleeping. Now, there are lots of reasons why people don't sleep. One of them is itch, and we obviously focus on that. But another one is dry eyes. I mean, if you are blinking at night and every time you're doing that, you get this gritty sensation, that can keep people awake. So have I treated fatigue by treating Sicca? Yeah, I have. Not commonly, but it's worth thinking about. So one of the things we encourage people always is to take a lateral view.
Yeah.
Don't over compartmentalize. Everything is linked to everything else.
Okay, perfect. Thank you.